In medical news, knee and hip pain affects millions of Americans. It can be debilitating, keep you in the house, and lead to other issues that come from inactivity like depression and then waking. But there's new hope for baby boomers. Joint replacement has improved dramatically in the last few years. Joining us live to talk about what's new and what it means to you is Mid-State Medical Center orthopedic surgeon Dr. Obi Osuji. Doctor, welcome back to CT Style.
Thanks for having me again.
So joint replacements have come a long way in the last couple of years, right?
Yes. Yes, one of the things that people have been asking about is a new technique for replacing the hip and doing a partial knee replacement. It's a robotically assisted procedure known as a MAKOPlasty. With this procedure, the surgeon is really able to achieve a really high level of precision in putting in the implants. In orthopedics, precision really matters, and not everyone is a candidate for this procedure, but in the right patient, it really can help facilitate faster recovery, decrease complication rate, and also lead to overall better outcome for the patient.
We're looking at some video right now. Who would be a good candidate for this?
Essentially anyone who is a candidate for a hip replacement or anyone who has involvement of, so arthritis involving just one of the compartments of the knee. So there are three compartments in the knee, the inner, the outer compartment, and then under the kneecap. So a patient who has arthritis that affects just one part of the knee would be a candidate for instance, for a partial knee replacement,
Sure.
a robotic one.
And doctor, people kind of live with this pain until it gets to a point where it's unbearable. What are some of the things a patient would need to know before undergoing the surgery?
Yeah, so I think one of the main reasons why people delay in having their joints done is because it involves an operation, and operations are scary. And what I'd like people to know is that hip replacement and knee replacement has come a really long way over the past few years. Our instruments and the materials that we use are much more advanced now. The instruments that we use to do the surgeries allows us to be very precise in what we do. For instance, with the robotic procedure, the surgeon can make a plan that accurately determines the correct size and alignment of the implant before surgery. Now, the robot doesn't do the surgery, but the robot really enables the surgeon to execute that pre-op plan. Last time I was here, we also talked about a technique for accessing the hip joint from the front, which is really a less invasive and muscle-sparing technique, the anterior approach. That's also a technique that can help with early recovery.
Sure, and the incisions are smaller now that you would make, right? Which leads to quicker recovery.
Yes, not just the length of the incision, but more importantly, the invasiveness of the procedure and what it is that is done during the procedure matters more than just the incision size.
Sure. And typically, how long is recovery?
For a partial knee replacement, it's somewhere around 4 to 6 weeks, and for a full hip replacement, closer to 6 to 8 weeks.
Got it. And what's great is that Mid-State is offering some workshops where you can get all the information you need before you decide to undergo the surgery.
Yes, absolutely.
That's happening November 9th, 6:30 to 7:30. It's going to be right at Mid-State Family Health Center in Meriden. Doctor, thank you so much for all the information.
Thank you very much.
You kind of take the scariness out of it, right?
Absolutely.
At least we try. And of course, for more information, log on to midstatemedical.com or call 1-866-633-2229.
Thank you.
All right, Ryan, we'll send things over to you.
Well